Hello and welcome back to my channel. In this video, I'm going to talk about a day in the life of a healthcare consultant. So in the previous video, I was talking about how to make a video on the daily work routine of a healthcare consultant. Now here we are, and let's dive in. So for a healthcare management consultant to be successful on a job, there are simple and more defined needs that need to be met first. First of all, you need a higher level of education. So prior to joining any healthcare industry, as a consultant, you must earn a bachelor's or master's degree from a recognized college or university. Here is an interview that we conducted with a client who have had his bachelor's and master's in a field that give him an opportunity to work as a consultant, as a healthcare management consultant. His name is John Doe. So during his interview, he went into detail about how his daily activities are structured, and I'm gonna expose you to his experience. My job responsibilities, this is John Doe speaking to us during an interview with him. My job responsibilities as a performance solution revolves around leading and driving hospital operations projects. Meaning, as a consultant, you may be placed on several projects, and the projects they placed him on is performance solution in the healthcare consulting company that he is working for. Most consultants, they have companies they work for, and these companies assign them various clients like hospitals, like clinics, and small practices, specialized hospitals. So John Doe is assigned to certain hospitals, and his job is to focus on performance solution. He's going to help all these hospitals to resolve their performance issues. So he's given us his detail of the days, his daily activities. So he says, my job responsibilities as a performance solution revolve around leading and driving hospital operation projects. In short, with a team composed of both consultants and hospital members together, we can help the hospital change or develop a new way to do its everyday operations, and ultimately to help more patients. The ultimate goal is to help more patients. To get things done, we use a combination of lean, a set of manufacturing improvement technique derived from Toyota production techniques, and Six Sigma, a rigorous statistical operation improvement process, and pulled from many years of consulting experience. Now, the Lean and the Six Sigma, I will go into detail of that particular technical tools at the end of the video, because this is very important. It's a leadership techniques, and they name it Six Sigma. They are receiving a certification you can have attached to that. That gives you a lot of opportunities, and it places you above many people that are that start with you. Even if you have bachelor's degree and you are able to attain this certification in addition to your bachelor's degree, you will stand out more than somebody with a master's degree or PhD without any experience or any of these leadership techniques. So I'm reading from John's perspective. There are also some opportunities to do product development and medical teaching. These projects allow you to gain experience by either facilitating teams of a client's employees or working with your peers, that is your fellow consultants, in getting statistical analysis and recommendation for addressing specific client goals. So typical day. According to John, this is what he does on a typical day. I woke up in a hotel room in New York City, pray and turn on my computer. I check email from my team leaders and reply as quickly as I can. It has become a game now to guess how much email is waiting for me in the morning. Anywhere from 12 to 35 messages, as some team members do most of their emailing late at night or extremely early in the morning. Wow, that's interesting. Now his typical day routine continues. At 9 a.m. I have a 10 a.m. client meeting, so I grab a cab going uptown to one of the hospitals. I'm currently working with a client to make sure that my clients and team members are gathering data or doing research for future improvements on our project's process. 11 a.m. At the hospital, I meet with teammates in our team. I'm sorry for this interruption. Okay. At 11 a.m. at the hospital, I meet with teammates in our team room to review the work we've done for clients' presentations and plan what future work. 12 o'clock, I grab a quick lunch from the deli across the street from the hospital. 1 p.m., I leave the hospital and grab a cab downtown for a 2 p.m. meeting with clients at another hospital. I'm working to discuss a similar project. So probably working on how to discuss a similar project with a different client at 2 p.m. I probably think he might be doing that whilst in the cab going. At 3:30 p.m. from this hospital, I conduct a teleconference meeting about a clinical practice improvement. Please, let's pay attention to what he actually do during those times and with the clients in this hospital. So a meeting about clinical practice improvement projects in New Jersey. I review work with a theme leader who has been a great mentor for me and make plans for what still needs to be done. 4 p.m. I finish up my meeting and start doing some of my work from the day. That is PowerPoint presentations, Excel spreadsheets, data analysis. Now, with these things, PowerPoint presentation, Excel, I wanted to start making videos on technical skills that you might need when you start working as a healthcare consultant. One of them is Excel. You're going to use Excel a lot, data analysis. I'm going to make a video on how to use Power BI is one of the great tools from Microsoft. This tool will help you to be great in your data analysis presentation. So after this video, I'm going to start diving into the technical skills that you will need to succeed in any job. Thank you. So I'll go back again and mention 4 p.m. 4 p.m. I finish up my meeting and start doing some of my work from the day, which is PowerPoint presentation, Excel spreadsheets, data analysis, and so many. At our workroom that the consultants have lovingly named the pit. So this is where he does these things in the pit, which was named by the consultants. Well, that's beautiful. At 6 p.m. I grab some dinner, either alone or with team members. Alternatively, sometimes when I'm in New York, I'll meet up with friends from B school, probably his medical school friends, or some other friend from college years, from high school, probably. He's just a neighborhood boy, I guess. And he resided in New York City, so why not? Meaning this is just activities after work. Now, 9:30 p.m. back in my hotel room, I make a few calls to loved ones and finish some leftover work. 11 p.m. finish up any email response and turn off my computer. 1 a.m. It's around now that I go to sleep. Wow. So meaning healthcare consultants, you got to be handy, you got to be on the move, you got to be very tenacious, happy. You know, you have to be the sunshine to be able to perform perfectly well. I'm sorry for that interruption. Here is a video I have made on an interview with ECG. ECG is a healthcare consulting company, and this is an interview they had with someone, maybe a presenter, just to enlighten people that have interest in becoming a healthcare management consultant. So I'm going to go ahead and play this short video and come back. I hope you like it. It's very, very educative and straight to the point. Gonna see the volume is high.
Healthcare is very fragmented in the United States. There's an incredible variability in the cost, the quality, the access to healthcare services across all populations.
If you look at the changes that are upon us related to payment reform, delivery reform, we're all going through a major transformation in terms of how we deliver care and how we finance that care.
Yeah, it's really exciting right now because there's a lot of changes in the marketplace. We're seeing a lot of consolidation happening with that. There's a lot of additional work that we're seeing.
It is such an incredibly exciting time to be entering the field. There is so much change. There is so much opportunity to make a difference in the healthcare environment. And as an organization, the value proposition that we're offering our employees is the chance not only to learn the fundamental trade craft of consulting, but also to make a direct impact on client organizations.
The biggest benefit you have is a young consultant at ECG. It's just the degree of responsibility that you're going to have right out of that.
So I've been with ECG going on 17 years, starting with an internship. It sounds funny, but I really fell in love with it from day one when I got here. As an intern, it wasn't okay, you're an intern. Go sit in the corner and work on this little project that no one's ever going to see. I got thrown right in the mix. I was doing analysis, I was interviewing clients, I was participating in client meetings, which was incredibly exciting to me.
Great. So that is an interview with the workers at ECG. Incredible. It's very encouraging. You can feel that you're doing something, you're in a field that is it's in a high demand, not only in the United States, probably everywhere, especially in this pandemic season. As soon as the pandemic is out, more healthcare consultants are going to be needed. You're going to be doing a lot of traveling. Now let's continue with John's interview. Here is some of the tools for success from John's perspective. John said, I can't say that I had any misconceptions about my current job, as I didn't know what to expect when I started. Initially, upon interviewing for the job, I thought I should have taken more questions and decision modeling courses in his business school, probably in his bachelor's degree. All right. However, I'm getting enough of a foundation here that I'm happy I took other finance, strategy, and accounting courses instead. Remember, the third video or so, I believe I have listed all the courses that you will, the major courses you'll be taking to be successful in this field. And lo and behold, yes, these courses have helped John to ground himself. Um, okay, I'll continue. You don't really need an MBA to do what I do. ABC. ABC happens to be the healthcare consultancy company he's working for. ABC Healthcare Consultancy has always been very good at investing in its people and giving them the tools that they need to succeed. After all, ABC practically wrote the books on leadership and management training. That's amazing. In the short time I've been here, ABC has trained me in its Six Sigma statistical methodologies, its culture change tools called Change Acceleration Process or CAP, and workout, used to make positive and lasting changes in how a company works. ABC has even allowed me to attend one of its leadership courses for project management. But the MBA definitely helps to understand some of the basic accounting and finance concepts when I am talking to hospital management. In addition, I've made some good friends at ABC who are extremely talented but also very generous in sharing their skills and knowledge as I try to share my clinical knowledge with them. As more opportunities becomes available to use my practical combination of skill sets, I intended to take advantage of them to help the company. Now, John tried to explain to us how to get hired at ABC, but the point is, all companies have similar method or ways of hiring people. So ABC is just an example of how other companies, especially healthcare consulting companies, conduct their hiring process. ABC Healthcare is expanding and looking for qualified, intelligent, and hardworking people who want to help build the healthcare business as well as become part of the ABC culture. Many of my peers have years of experience at ABC and are experts in using all of ABC's tools to positively change organizations. Some of my colleagues also have prior consulting or healthcare experience, but all are dedicated professionals. I had some minor consulting experience prior to this job from work I did during business school. Remember, I mentioned that taking an internship and also volunteering can prepare you ahead of time. But it was my clinical background combined with the MBA that made this job a good fit. Now, some people can pass through so many other ways to come in. Probably this guy might have been a medical doctor and have MBA from somewhere and then even went to business school. But anything that is to do with management will prepare you to be a great consultant. And healthcare management will be the best. The reason is now healthcare has become like the hot cake now when it comes to getting a good job. So diving management into healthcare is a great deal. All right, I continue to read. Ultimately, I landed my job because one of my fellow Rhoda aluminum was brought in to help build the business in ABC Healthcare Performance Solutions, and he wanted to bring in solution-driven professionals to help him realize this goal. He went through Rhoda's resume book of recent graduates and contacted me months later. I'm glad he did, as I'm tremendously enjoying the work, the training, and the growth opportunities at ABC. Alright, like I said earlier, I would like to explain a little bit into detail about Lean and Six Sigma tools. The Certified Six Sigma Black Belt is a professional. This is one of the level. Actually, the Six Sigma and Lean has yellow belt, black belt, master belt, and so on. These are trainings and tools and techniques that is good in every business organization. When you get certain level, you get a better opportunities and you are open to learning more about organization structure, strategies, and how to build any organization to be successful. So a black belt is a rank that is higher than the lower rank is yellow belt, and now the black belt is a professional. This is a professional who can explain Six Sigma philosophies and principles, including supporting systems and tools. Black belts have a thorough understanding of all aspects of the define, measure, analysis, or analyze, improve, and control. Define, measure, analyze, improve, and control. And so the black belts have a thorough understanding of all these aspects of this model in accordance with the Six Sigma principles. Who should certify? A certified Six Sigma black belt is a professional who can explain Six Sigma philosophies and principles, including support, like I mentioned earlier. A black belt should demonstrate team leadership, understanding of team dynamics, and assign team members roles and responsibilities. So they oversee, supervise the yellow belt who is under them. Black belts have a thorough understanding of all aspects, and so that is why they should be the one that they can have this certification. But before you get this certification, you have to demonstrate your knowledge. not only in writing exam to get certified, but you have to demonstrate these skills, these competencies, this show these responsibilities during your work, so your supervisors or your managers, your directors can see that in you and qualify you to take the certification exam. Or you can be part of some associations that will assess your hard work and promote you to take the certification exam. They have basic knowledge of lean enterprise concept, and are able to identify non-value added elements and activities, and are also able to use specific tools, definitely management tools. Now, the Lean Six Sigma in healthcare. Both methodologies drives to optimize operations and increase value for patients. However, while Lean focus on eliminating waste, Six Sigma seeks to reduce variation by decreasing defects to a specific strategical or statistical measures. Statistical measures. Now, if you wanted me to do more do video to explain more about the Lean and Six Sigma, please let me know. Please leave a comment so that I can do more research on this, because it's very important. I can go into details on the Lean Six Sigma and each and every aspect of it, because I have taken the prerequisite classes already. So that is why I would like to make a video on it, but it have to be a request, because if it's not a request, then people will be confused of how the Lean Six Sigma has to be connected to healthcare consultants career. It is important, but you are not obliged to have it. It will give you more knowledge and ground you well to perform great, but it's not a requirement, it's a choice, which is why I would like to know those who want us to know more about it, then I can make a video on it. Now I come to the end of today's video, and these are the references, these are places where I got information from to create this video. If you need more detail on anything that I have mentioned in this video, please leave a comment below. Now, like I mentioned in the video, I say that I wanted to do videos on helpful technical skills that you need, because before you start a job, especially in the healthcare field, healthcare is kind of combining technology, information technology seriously, because now look at COVID-19. Many people that have these technical skills in software and in hardware, it's kind of very easy for them to work from home. There's a telehealth now for many therapists to be at home and be working and other things. So I think the best thing you want to do is to have this technical knowledge, so you can work more independently than having to be in an office space where you can easily access the technical teams, like the IT teams or any other group of people that you might need. These days you want to be able to do a lot of things on your own. So you don't want to be a healthcare consultant that will need somebody to create your PowerPoint for you. At certain points, you're going to need a SQL, you're going to need a Python, you're going to need Power BI, you're going to need Excel. All these skills are varied. Some of them are back-end programming languages, and some of them probably back-end programming languages and simple technical skills are going to be very, very important. The front end, you might not need it too much like that. So I hope this video helps many people, and please like and subscribe to my channel. Subscribe.